Hello, I'm Barb Kratz. I'm a pediatric nurse practitioner and I work at Fairview University Medical Center. I've spent the past 20-some years in my nursing career focusing on the care of children and families with chronic illness and children who have developmental disabilities. I'm happy to talk with you today about children and families and youth related to transition care. I would like to talk with you today about the role of professionals supporting parents within the practice that you work. As I speak, I will talk both from a perspective of a professional, but also from the perspective of a parent. I have two children. I have a son who is a young adult who is 23 and has a diagnosis of Down syndrome, and then I have a daughter 19. So I will give examples from both experiences. I believe that as we talk about transition, it's really important to consider a developmental framework. And I speak of that both in terms of individual developmental tasks, but then family developmental tasks that we would look at within a family systems framework. It's very important to consider the broader aspect of the family system as we talk about transition, because it's support to all individuals in that system that help us get down to individualizing and maximizing the care to the individual. As I'm talking today, I want you to think about the concept of a medical home, which is really a theoretical concept where the components of family-centered care are incorporated. And following, I'll go a little bit more into those components, which I believe you well know on family-centered care. I'd like to talk briefly about some important concepts in family-centered care. The first of those being empowering families. And I believe we do that really in the way we listen to families and listen to what things are of utmost importance to them, listening to their agenda rather than presenting our agenda. Another important concept would be the concept of social supports to families. What are both those formal and informal support systems that help them to be able to maximize family functioning, which again in turn helps that high level of care be transferred to their child or youth and to be able to maximize their functioning. Those are two critical concepts, I believe, that as we go forward and talk during this presentation will be a thread throughout. In 2001, I had the opportunity to participate in a national transition conference. In preparation for that conference, I asked a parent to write a personal essay, and I'd like to share a few excerpts from that essay with you today. Transition is another word for change. When you apply the word transition to an IEP or anything that has been designed to map out a child's future, it has been historically promoted to mean moving on or upward toward adulthood and or independence. However, a transition between medical care professionals for families with a special needs child is usually not good. The end result of the change may be very good for the child and his family, but their immediate feelings toward the transition are almost inevitably going to be ones of sadness and even panic. Families often develop a personal relationship or bond with individuals that invest a good deal of time helping them care for their child. Therefore, they often experience confusing and conflicting emotions surrounding the departure of medical personnel who have cared for and about their chronically ill child. I had the opportunity last fall to hear a parent panel where parents were summarizing what was really important to them in terms of care for their chronically ill children or children who have disabilities. These are the things that they said was important: listening, guidance, anticipate and prepare for what is next, support groups, both for the parents and for the children and youth themselves, respite, Respite so that they can provide care to other children in the family, and respite so that the parents themselves can focus on their relationship as individuals. Partnership. Partnership with all the professionals who are involved in the care of their child. Confidentiality was one that was a surprise to me, but parents wanted education on confidentiality, particularly as their youth become young adults and they may no longer be privileged to the information that is being presented to the young adult themselves. And then treating people as people first, not as their disease first or their chronic illness first or their symptoms, but considering them as a person first. I would like to share with you a few vignettes that will help to personalize information on transition rather than just receiving the information from a theoretical perspective. I want to share a vignette talking about risk, and I will speak about my son who's 23 with Down syndrome. We were in Philadelphia for a National Down Syndrome Conference. A peer of Tim's was there who was very independent, had his own cell phone, his own credit card, had his own hotel room, and Tim was saying, why don't I have those things, Mom? I want those same things. So it really challenged me to look at Tim and look at where he was developmentally to see if he might be ready for some of those things. At the conference, I was able to have this other young adult show Tim the way to his hotel room because he wasn't prepared to do that on his own. And I was also able to let Tim go with this young man to lunch. He left a $20 tip, but we were able to remedy that situation. However, what I need to say as Tim's parent is when I went to find him in a place where he was supposed to be and he wasn't there, I had a knot in my stomach. And so I think often for parents, as we choose to enhance our child's independence, it's again that fear of vulnerability and letting go. I found him up in the room listening to his headset, so obviously he was more ready for this than I was. Next, I want to talk about a 22-year-old young adult, and I want to talk about risk. And I want to talk about services in a more generalized context. This individual spent his day at a home for ventilator-dependent individuals and became very depressed after a friend of his committed suicide. It was really myself linking with county social services to see what other options for programs might be available for this young man. And by putting efforts together of both myself and a county case manager, we were able to switch care from the typical medical assistance model to a waiver model of care where there was more flexibility in being able to provide service for this young man. However, I want to say that the parent was very frightened of giving up the type of insurance that she knew to switch to a model that she didn't know. And so often as we make decisions to provide more flexibility, there is also fear related to how that might negatively impact an adolescent or their family. I want to talk about the role of parents in a little more detail. And I want to talk about thinking about self-care for parents. I think often in our practices we focus our care on the youth, and really I believe what I've learned in the broader concept of care is that when we are able to also provide care to individuals in the broader family system, better outcomes again come down to the individual. And so I think taking time at the visits to really ask parents, how are you doing as a care provider, is critical. Looking again at supports to the families, looking at what they need for both formal and informal supports. And this isn't a one-time thing that we should assess. It should be an assessment that occurs at every visit. We know that families are constantly in flux and constantly changing and have many things impacting them at a day-to-day basis. Many families are being challenged by some of the financial impact of healthcare today, and when cutbacks occur at a state level, how do those cutbacks affect families? This past year, in terms of parental fees, I've spoken with many families who are owing balances in the thousands of dollars for care that their children have received, and they're trying to figure out how to be fiscally responsible for the amount owed, and yet to continue to advocate for the high technology and high quality services that they need for their child. Another change that I want to mention is that when children come into the hospital, because of the changes in staffing in the hospital, parents are also relied upon at that time as being key caretakers for their child, and maybe it's a time where the parent needs respite. And I think often what happens is that individuals judge families within the environment where they are present. For example, possibly hospital nurses making a judgment on the parent if they aren't able to provide that care during that admission, rather than looking at the broader day-to-day life for families and how they might need a break for that.
Some of the things that my parents did to sort of help me plan for transition and begin to manage my own health care were just to really involve me in the process of learning about my condition from very early on up until now. They're still giving me information that's very useful for me as far as medical treatments that I received very early on in life, and helping me. They continue to help me to understand very difficult medical sorts of terms and conditions and things. And I think one of the greatest things that my mother was the primary person that would come to my doctor's appointments with me. She had an easier time taking off of work than my dad did. So she would consistently go to my appointments with me, but she would ensure that doctors and other healthcare professionals were speaking directly with me.
It's really important that we share the majority of information that we have about children with their families. I think families are becoming more sophisticated all the time in their ability to access information with the different modes of technology that we have now. I also believe because families can do that, we need to make sure that the information they are receiving is accurate and good sources of information. So our role is broadened as technology is broadened. It's important to seek input from children at a very young age. It amazes me what children at ages prior to even preschool can tell us about what's going on with them. I've had the opportunity to interview many preschool children and even children with autism who have the ability to tell us so much. What also is amazing to me is how we can teach children at that very young age about their body and how they can be in charge of their body, and to teach them about emotions and how they can control emotions. And these are all things that we can start at that young age again and build upon those at different developmental stages to maximize a child's functioning over time. It's important to seek out preferences that youth have in the way things are done to them rather than just doing. To give them choices, then we can role model the choice giving in our visits with families. We can role model teaching them about their body by doing a teaching physical exam and by naming the different body parts. As we, as healthcare providers, develop effective modes of communication, we can share those with families. I think, again, our ability to communicate with them is enhanced by technology. How do we use email to communicate with families and yet ensure privacy and confidentiality? How do we use faxes? I want to talk about some summary comments from research that was done where 753 parents were surveyed to assess their perceptions of their healthcare providers' level of involvement in various transition activities and the extent to which they felt it was the provider's responsibility to assist with each particular activity. And note that there were 13 different transition activities. And then in this same research study, 141 healthcare providers, primarily pediatricians, were assessed regarding their level of participation in the same activities and the extent to which they felt it was their responsibility to assist with each of these transition activities. I'm not going to focus in detail on the results, but I want to focus on some of the qualitative comments and suggestions from parents. Comprehensive coordinated care was very important to families. There was the usefulness of having a central person who could help develop a care plan, manage the communication between healthcare providers and/or agencies, and also for them to have enough time to meet and discuss the child's health plan with the family was important. Again, those summarize the concepts in a medical home or family-centered care. In addition, they wanted healthcare professionals to have increased knowledge about caring for children with special healthcare needs. Families wanted input on which providers in the community might have that expertise and how they could access those providers. Parents highlighted the importance of a more holistic approach to healthcare and emotional well-being. And I would say that's something we're seeing daily in our practice too. Parents are asking about alternative non-medical strategies to incorporate in their child's care. There also was a desire to have an emphasis on healthcare practitioners working directly with adolescents. Parents wanted mentoring of the adolescent, either with linking them with other adolescents or direct mentoring by the healthcare provider. They also wanted their adolescents to have an opportunity to meet other successful young adults who might have a similar illness. They wanted increased health provider time spent with families, and they wanted to be listened to. They also wanted more choices in selecting their healthcare providers. In summary, to bring closure, I want to say that each of us has the ability to promote independence for those with whom we work and to impact transition for both the children and the families in a positive way. And I want to leave you with two images that I had personally as I was going through one of those key transitions in my life of turning 50. And last summer, I had the opportunity to be on Cape Cod for a conference with a friend of mine. And the day after we arrived there, we were heading out toward the ocean on a boulder wall. And as we traversed across the boulder, from time to time, I would need the help of a holding hand to get me across a critical place that I could not have made it on my own. And after we got across the boulder wall, we hit the sand dunes. And as we were walking across the sand dunes, occasionally a foot would get stuck and it would take some time to move forward. But the journey was a little bit easier. And at that point, there was time to really focus on the friendship and what was important, to listen to each other and to be present with somebody who had similar values. And then beyond the dunes came the ocean. And when we got to the ocean, you could see ships sailing in the horizon. And after I got back home, I woke up at 2 o'clock in the morning one night, and I just thought, this is the picture. This is a picture of what it's been like for me as a parent of a child with a disability. And it's not a one-way hike going from the boulders to the dunes to the ocean. It's a back and forth. It's a to and fro. And I believe for many of the families that we work with, it's that way for them too. And we need to be present and to help them anticipate when they're going to hit the boulders, and then to have as our goal of getting them to the ocean. The next image I would like to leave you with is more an image of the youth themselves. And we were by the ocean. We were standing at the top at a stone wall, my friend and I, looking down. And it was a foggy day, and there were many children running in the sand by the ocean, playing independently and having fun. They were free spirited. And off to the side were the counselors, being there, being present but not directly involved, but ready to pull in that safety net if need be. And I think that again is just such a vision of how we need to look at the care we provide and let individuals take that risk and go forward and yet have the safety net there, ready to pull it in if need be so that bad consequences don't happen. And yet really ultimately our goal is to be able to have individuals feel that free spirit. And certainly I can feel that every day as a parent for my son. When I call him a child, he'll look at me and he'll go, "Mom, I am not a child. I am an adult." And so that really is our goal, is to let go and cut those strings and yet to provide both formal and informal support so that youth can transcend to a better place.